Hi guys, welcome back. I'm Mary Smiu. I'm your new nurse in town. So guys, this is the second part of the presentation on COVID-19. If you haven't gone through the first part, the introductory part, I please request you to go through it so that we understand it systematically, how it goes. Start from the introduction part of it, and then come to this video. So guys, please you'll excuse me. I might not focus on the camera because I'm reading some notes here. As I told you, we had a 2-day training. So I had to make some short notes to help me present to you this COVID-19 information. So guys, I hope you are okay on the same page. And please, if you have any question, any concern, it's good. Let's share. Just comment. Leave a comment. Ask a question. And I think we'll all do research, or we will engage some other experts so that they can elaborate to us and understand more on COVID-19. So please feel free to share, to like, and to leave a comment. Yeah. So in the last video, I think I left it on transmission. We said it's worldwide. The transmission is worldwide. Most commonly spread from an infected person to others through the air by coughing, sneezing, or talking. Also, you have close personal contact. That's why we are encouraged to keep the social distance. Commonly occurs in cold season. As it is now, it's so cold. And I think that's why we have a rising number in the COVID-19. Maybe. Most people will get infected in their lifetime. And this one, we just refuse it in the mighty name of Jesus Christ, by the way. Most people will get infected in their lifetime. Why? God will keep us safe. But first, your responsibility is key. Be responsible. Be careful. All things will be fine, guys. So, incubation, we said, is 3 to 7 days, and it goes up to 2 weeks. So nowadays it can go up to 21 days. This is the incubation period. From 3 days to 21, probably that's the time when someone will start showing signs and symptoms. Epidemiology of COVID-19, previously known as coronavirus. Disease caused by coronavirus, renamed COVID-19 in February 2020. That's when coronavirus was named COVID-19, because it started 2019. That's when it started spreading in 2019. It was identified in Wuhan, China in 2019. Initial cases all linked to Wuhan seafood. Then excuse me guys, I just have to read. So please bear with me. The market was closed on 1st January 2020 for environmental sanitation and disinfection. In 30th January, COVID-19 was declared public health emergency of international concern. In January, the disease was spreading very fast, and then it was declared public health emergency of international concern. 11th March, it was declared pandemic. So in 11th March, it was declared pandemic, meaning it could spread to any country or to a large number. It could affect so many people worldwide. So with time, the epicenter shifted from China to Europe and then to the USA. Remember, initially the epicenter was Wuhan, China, but now the epicenter, by that time, it had already shifted from China to Europe and the USA. Clinical features. We all know the clinical features of COVID-19. Maybe to just remind us. Most associated with upper respiratory tract infection in children. Pneumonia and lower respiratory tract infection may occur in immunocompromised, asthmatic, and COPD. Most common symptoms include the common ones we know, right? Fever, chills, coughing, sore throat, body aches, and progressing to pneumonia. The symptoms vary from asymptomatic forms to respiratory failure. It's very serious. It can lead to respiratory failure, guys. Risk factors for severe disease. So these are the people who are on high risk these are people with high risk to COVID-19. The cardiovascular disease, diabetic mellitus, hypertension, chronic lung disease, cancer, chronic kidney disease, HIV, and obesity. Lifestyle. Guys, you can control this obesity. Let's live healthy. Let's have a healthy life. Reduce that weight. By that, it's a risk factor. When you are obese with COVID-19, cardiovascular disease, diabetic mellitus, HTN, that's the hypertension, chronic lung disease, cancer, these are the conditions that really lowers our immunity. So we need to be very, very careful. Let's look at the Kenyan situation. First case was identified on 13th March 2020. Self-quarantine of all people arriving from other countries. Mandatory quarantine of travelers from foreign countries. We all remember that time that some of the travelers were really stranded in the airport, that they had to go through the mandatory quarantine. So yeah, and I think it helped in one way or another. International flights was banned on 25th March. Do you remember? It was banned on 25th March. Curfew from 27th March. Yeah, the curfew that was directed by the president. I think from 7 p.m. to 5 a.m. Yes. It was started on 27th March 2020. Then we had IPC measures. That's the infection prevention control measures was initiated nationally. The IPC measures, that is washing hands, wearing masks, using sanitizers, keeping social distance, those ones. Targeted testing. We started hearing the number tested, positive cases, recovered patients, and the deaths, courtesy of Mutahi Kagwe and the team. Thank you very much for keeping us always. And I think this information is very important for each and every one of us, as long as we are scared of this COVID-19. But I also think it's very important. Tomorrow you hear that this region is highly affected, this region is less affected, this county has a high number. So I think it is very important for us to be more cautious on ourselves. Yeah. Let's go to surveillance. Surveillance is a systematic collection, analysis, and interpretation of health-related data essential to the planning, implementation, and evaluation of public health practice. Closely integrated with the timely dissemination of this data to those responsible for prevention and control. Regardless of the type of surveillance, remember that surveillance is data for action. At all health levels, health facilities should have rapid response teams. I hope every facility has these RRT teams, because they are the teams that are now following these patients. If you have a suspected client in your facility, you have this rapid response 24/7 that are there to take details of this patient, they trace the contacts of this patient or the suspected case. This is majorly the main function of the rapid response teams. Rapid response teams should respond to COVID-19 alerts 24/7. Yes, tukue macho. Should include, so this is the components of the rapid response team. It should include the following people. It should have the epidemiologist, the clinician, infection prevention control expert, for example, a nurse, data manager, lab personnel, environmental health. These people, the rapid response team and frontline healthcare workers, should be trained on basic knowledge on COVID-19. Make sure the team that is in RRT should have knowledge on COVID-19. Use of working case definition and signals. Should know on the PPEs, personal protective equipment. Should be aware of the surveillance tools, contact tracing, and communication skills, of course. We need these people who are patient when you go to the community and maybe you are tracing a contact. You go with good communication skills. You can't be there and you be like, we are here to track those patients, those who are in contact with COVID-19 patient. You go like you are demanding or something. You scare the patient. So use correct communication skills. Tell them the importance, why you want to trace these contacts. How will it benefit the community and the family? Just tell them in a humble way. I think they'll understand. So you need to have those communication skills also. Standard case definition. During threats of COVID-19 outbreak routine, severe acute respiratory infection surveillance is strengthened. Severe acute respiratory infection is severe acute respiratory illness with fever of equal to or more than 38 degrees centigrade, plus cough, sore throat, or difficulty in breathing. Okay? Yeah. That require hospitalization. Yes. Working case definition. During a threat or an outbreak of a disease, the Ministry of Health develops a working case definition to enhance detection of the disease. The working case definition takes into context of the disease, such as clinical, personal, place and time criteria. The COVID-19 working case definition, developed by the World Ministry of Health, considers suspected, probable, and confirmed cases. So guys, let's look at this, or what are these people? The suspected case, the probable case, and the confirmed case. Please, let's begin so that we don't confuse. Suspected case is any person with any acute respiratory illness, e.g., fever, cough, or difficulty in breathing, and at least the following. A suspected case is this person with the following respiratory illness like fever, cough, or difficulty in breathing, and at least the following. This person has a history of travel. At first we were talking about China, but now that the pandemic is here with us, COVID is here in Kenya, I think we should talk of the highly affected counties like Nairobi, Mombasa, Machakos, Busia. Which other counties are most highly COVID? I think at least 43 over 47, most of the counties are affected. So we are talking of the highly affected, those counties with high numbers of COVID-19. So if this person has a history of travel from these highly affected counties and has signs and symptoms of respiratory illness such as cough, fever, and difficulty in breathing, this is a suspect guy. This is a suspected case. Yeah. Also, if this person has close contact with a confirmed or a probable case of COVID-19 in the 14 days prior to illness. If I'm a nurse, I came into contact with COVID-19 patient, or I attended to a COVID-19 patient who was a suspect but later confirmed to be COVID-19. Then I will be a first contact, a suspected case. A probable case, a suspect case of home testing of COVID-19 is inconclusive. A probable case is when a suspect of home testing of COVID-19 is inconclusive. We are not sure if this person is COVID-19 or not. Maybe the results were invalid, or the sample they normally take the nasopharyngeal swab and the oropharyngeal swab, or maybe these samples were tampered with, or maybe they are not enough. So we are not sure that this person is COVID-19 positive or negative. That's a probable case. A confirmed case is a person with laboratory confirmation of COVID-19 infection is conclusive, irrespective of clinical signs and symptoms. Yeah, this is just self-explanatory. Confirmed case is when this person has been confirmed to be COVID-19 positive, whether she or he has signs or symptoms or not. COVID-19 signals. Our first signal is any person with a history of travel or contact who has visited, lived, worked, traveled, attended a function, or provided care with a person who has traveled from China initially, but currently we are talking of the most affected counties, for example, Nairobi. Then second, any person who reports or presents with fever, cough, sore throat, or difficulty in breathing, which has not responded to therapy. That's our second signal. That's a danger sign, by the way, of COVID-19. Application of COVID-19 signals. How do we manage such like cases? All healthcare workers, community health volunteers, and community members must monitor the COVID-19 signals. Once a signal is detected, it must be reported to either community health worker, or it can be reported in a nearby health facility, surveillance focal person, or in the to the Ministry of Health. The community health worker or volunteer, with the support of the sub-county disease surveillance coordinator, immediately undertakes the following. So when we have a case, or we have a suspect or a signal, we also notify the sub-county disease surveillance coordinator, and then the sub-county disease surveillance coordinator takes the following measures. First, they verification. They verify whether the signal is factual or false. Assessment. If the signal is factual, assess it against COVID-19. If the signal meets the COVID-19 working case definition, consider it a suspected case. You know how it now goes. It should be systematic. That's why it's very important for you to notify the sub-county any suspected or any signal of COVID-19. When a suspected COVID-19 is detected, we have some steps that we have to follow. These include, Safety. Your safety as a person and as an individual. Your safety first. Make sure you wear your PPEs properly. Make sure you have gloves on. Your mask you have worn your mask properly. If you have other PPEs like the gowns, the goggles, the face shield, you can put it on if you have a suspected case. Make sure that you are safety first. Notification. Confirmation. So remember, confirmation is through the Sub-County Disease Surveillance Coordinator. Documentation. Of course, you have to document everything, including the personal details of this person or of this suspected case. Remember, you are going to trace this patient or to trace the contacts of these clients through the chiefs and the community health workers. Then contact tracing and follow-up, very important. Risk communication, data management. On safety, we are talking about PPEs. So if you have a suspected case, maybe in your dispensary or health facility, immediately you don PPEs. That's the personal protective equipment. You isolate the patient in a well-ventilated room. That's a single room. And give supportive care. It's not that if you isolate this patient he or she doesn't have other needs. This patient will need food. This patient will need some psychosocial counseling or psychosocial support. This patient will have to communicate to family members. You make sure you provide at least mobile phones. Then, if you're good enough, you can at least put a television in that room so that this person can be it might give him or her peace of mind to forget some of this. You understand? Yeah, of course it will affect him or her psychologically. So you give supportive care. Provide the suspected case with mask. So remember, this is a suspected case. Make sure he or she has worn the mask. If at all he or she becomes a confirmed case or is COVID-19 positive, at least you are controlling the spread of the virus. So the patient or the client should wear a mask frequently. Should wear mask, guys. Yes. Where are we? We also restrict visitors or relatives from visiting the patient. Okay, we don't allow visitors to see the patient because this is our suspect of COVID-19. Avoid contact with your body parts. This is obvious. Notification. All suspected cases must be immediately reported. As I said earlier, signals are reported to the community health workers for verification. All verified signals must be reported to the Sub-County Disease Surveillance Coordinator. Confirmation, sample collection. Take nasopharyngeal from the nose and oropharyngeal swab and blood samples. You fill the COVID-19 case investigation form. Triple package the specimen as whole blood and put in a cooler box. Transport the packaged specimen using the fastest means available to the Nation Influenza Center lab. But nowadays, I think COVID-19 is done mostly in some counties or almost all the counties. So you make sure your swab, your specimen are transported immediately. Remember, we don't want them to be tampered with or maybe to spoil or something. So make sure you transport the specimen immediately. Confirmation, filling the case investigation form. A record of all cases must be kept as a line list. A case investigation form should be completed for every case meeting the suspected case definition. Each lab specimens collected from suspected cases must be accompanied by its case investigation form. Yes, guys, documentation. The healthcare workers should capture details of the COVID-19 in the prerequisite registers. Documentation is very important. Make sure that you capture the details of the COVID-19 suspects. Copies of case investigation form and the updated line list should be submitted to the next higher level daily. Management of contacts. A contact is a person providing direct care for COVID-19 patients, visiting patients, or staying in the same close environment of a COVID patient. That's a contact. For example, you are a nurse. You are nursing a COVID-19 patient. You are a direct contact. Or you are a relative. Maybe it's your wife, it's your child, it's your husband. You are there as a family. You are the contacts. So some of the contacts we said, providing direct care for COVID-19 patients, e.g. the nurses, doctors, lab technicians, all the healthcare workers, working together in close proximity. That's also a contact. Traveling together with COVID-19 patient. Living in the same household with COVID-19 patient. Contact identification and follow-up. When a suspected, a probable, or a confirmed case is detected, hope we really understand now the difference between a suspected, a probable, and a confirmed case. Hope we really remember. All individuals that had direct contact with the case should be listed. Should be listed using the contact listing form. So there are these forms that should be given to, I think should be given to every health facility, so that if you have a case, we have contact tracing form and a contact listing form. So all these contacts that came, all these people who came in contact with the COVID-19 patient should be filled in the contact listing form. All listed contacts are followed up on a daily basis for 14 or 21 days from the day of the last exposure using the contact follow-up form. So we have the contact listing form to list those people who came in contact with the patient of the COVID-19, and we have the follow-up form, which should be followed up on a daily basis for 14 days or 21 days. Yeah, are we together? You don't have to know everything, guys. Just know they're important to know. It's important to know, but